Assalamualaikum, sir.
Assalamu alaikum. You okay?
Yes, I'm okay.
Before we start, let me introduce myself to the audience, okay? So that we could tell that what is going on here. I'm so glad that you're here, first of all.
Thank you, sir.
Mr. Nurse.
Yes.
Okay. And basically today what is happening here, we are trying to mimic or kind of giving a mock of OET speaking one role play. In a real test, you'll be getting 2 role plays for 20 minutes. We'll be taking 3 minutes to prepare and 7 minutes to speak on that. Okay, so it is one role play only. I'll be helping him to be his interlocutor today. And the setting is basically a children's hospital, okay? And I'm a father of 3-year son, and he is my nurse over there, and I am the person who is reluctant that he does not or should not kind of test or diagnose my son. I want some doctor to be there, but doctors are busy and he has to handle it. Yeah?
Yes.
So how do you introduce yourself to my audience, Mr. Barnabas? Who you are?
I'm Barnabas. I'm nurse, and today is my duty with the children. Oh, then I.
Okay, so you're in the children ward for now.
Yes.
Alright, G. We are taking at least 1 minute, and you may think about it if you could have been to the Barnabas chair, what you could have spoken, you see. The interlocutor, him or herself, doesn't know anything about the medical things. It is purely 95% the assessment with the language. I will be giving my feedback in the end, and most importantly, in the real test. Once you do it, the same thing basically recorded, and that is to be sent to some expert, and the expert gives the feedback as well as the score. And he will try his best to get the B. Taking 1 minute with your permission, and then we'll start talking. You have a minute to think about it. Okay, thank you. You may start your time. Yeah, it is started. Yeah. Are we good to go? You may start the timer for 7 minutes now. We're good to go. You may stop it and just, yeah. Alright, G. So we are starting it right away. You may greet me and then we can start.
Assalamualaikum, sir.
Walaikum assalam. Where's the doctor?
Sorry, sir. Today I'm your nurse.
Mhm.
Let me explain myself.
Okay.
Tell you first.
Take 2, no problem. Okay, we are starting it again, okay, all the way. And we're not deleting it because it happens.
Yes.
It's okay. So starting again with you, you may greet me and then you tell me who you are, and then I'm the one who is agitated.
Okay.
Okay, so I will be rude with you, a little uncouth with you. So try your level best that you keep calm and you let me stay calm as well. Please, starting with you.
So, sir, I called doctor, but doctor is not here yet. I don't know why, but time is about to come doctor here.
You said that
But-
you are a nurse here, right?
Yes, I'm.
So
nurse
who's the
here.
one to tell me where's the doctor?
I'm a responsible person, but today is doctor not here. That's why I'm explaining you what is the problem behind it. I don't know, but the reason something better than that thing happens here.
You know, my honey little children, a child of mine, he is just 3 years old, okay? His mother left him when he was 1 year old. So I'm the only parent now.
Okay.
I am as concerned as could be the Prime Minister of the United States or the President of the United States of America for the state itself. This is my overall state, a 3 years child only. You're giving me such basic excuses. Where is my doctor?
Actually, he's an emergency. That's why he look after some patients.
Am I supposed to believe you? Or he's busy with some big clients who have good money to pay?
Oh, sir, you have to believe me because today there is such a busy emergency day.
Mhm.
That's why doctor was busy with the patient.
Okay. But when I look at my child, I think he may be expired in a while and your doctor will stay busy.
No, that's not problem. He's not expired. May God bless him. But meanwhile, doctor come. We take care of him. We take history of him. Let me talk about his condition after a few days back. What is the condition?
You see, a few days back, my child was playing in the ground. He was all good, all happy throughout, okay?
Okay.
He was going for his regular academy, school, and everything was going so well. In fact, I cooked for him the good meal, and he enjoyed the most of it. And I know my child is very epicurious, and he's the one who could eat a giant when he's hungry. But today I could see that he couldn't eat anything, okay? Since 9 a.m., I am waiting here for the doctor. It is almost 12 p.m. and none of you have shown up, and now you're giving such excuse to me. I am sure that he is asthmatic and he has asthma attack. Can you do something for it?
Sir, it is just likely as asthmatic attack, but it needs further investigation.
Okay.
What will the doctor do after that? He will do X-ray
Okay.
and then maybe needs CT scan.
Okay.
Then he do a decision that what is this? What is the clear picture?
Right.
Because
It's been how long that you are serving here?
it's take time.
Okay.
Not that much time, but we have some time to take
I
time.
understand that. My question is still the same from you. It's been how long that you are serving here in the hospital?
I'm here from 6 years.
Okay.
That's why I have some knowledge about disease.
Okay.
And you think that I'm do something for your son?
Can you get me a doctor? This is my question from you. Can you get me the doctor, please?
Oh, okay. Let we take his vital signs first.
Okay.
The basic things.
Okay.
These things is very necessary
Mhm.
before any investigations.
Okay.
Let we attach some monitor.
Okay.
There is a monitor for saturation. Saturation is something like oxygen,
Mhm.
oxygen in your body.
Mhm.
It is more than it should be more than 90%.
Mhm.
If there is a more than 90%, your baby is okay.
Okay.
Fine. And there is a almost fine.
Mhm.
He's looking fine.
Okay.
He's not breathing very aggressively.
You see, if he could have been your baby, you couldn't have said the same thing as you're saying to me now. He is part of my body. I understand he is not fine at all. Okay, he is completely silent. He never stays silent throughout the night. Okay, so what is happening exactly is there is something going on inside. I am not sure. And in this big hospital, I am not finding the doctor. Why I have come to this private hospital? Could have gone to some government local hospital. So what's the difference then?
You are quite right, but we look after here mostly these patients because there is a season. There is a season of cold, there is
Okay.
a season of flu.
Mhm.
It's just picture of flu and maybe it's asthmatic attack, but I'm not sure.
Mhm.
I'm quack. I'm
Okay.
not a doctor.
Okay, okay. So how shall I let the quack diagnose my child? Why shall I do that?
I'm not diagnosing him.
Okay.
I'm just assume that doctor will do this and make a decision for his diagnosis
Okay.
and treatment.
And meanwhile, you're just wasting my time?
I'm not wasting time.
So what are you doing
I
then?
take vital signs. I
Okay.
take notes
Okay.
for assessment.
Okay.
It will be help to doctor.
Check my child then and let me know what is happening to him.
Okay, thank you, sir. I check your baby.
Mhm.
His vitals is quite fine. His
Okay.
saturation was fine.
Mhm.
His breathing pattern was fine.
Mhm.
It's have some problem
Mhm.
with the breathing because he is not a deep breathing. He's
Okay.
shallow breathing,
Mhm.
but not that much rapid.
Okay, so it means there is some problem.
There is something problem,
Okay.
but not that much serious problem.
All right. I am glad that you tried to convince me. And at least there was someone to take care of my baby. Okay, and I'm very happy with the polite gestures you have made throughout.
Thank you, sir.
I am going to report about the doctor and I'm going to give a reward to the nurse. Thank you very much for your time,
Thank
dear
you,
nurse.
sir.
Thank you very much. All right, listeners, you okay?
Yes, I'm fine.
Actually, he was the one over there to try to put ultimate pressure on Mr. Barnabas, okay? And my job was to just try inquiring the things, okay? He was a silent observer. Let's listen to his feedback, and then I'll be giving my feedback as well. So, Mr. Sunil, how did you find this?
Hello everyone. I'm also a nurse. I'm currently working in Shifa International. Actually, I was observing all those things where the two persons were talking about all the scenario about the patient who was a child, 3 years child, and during the talk, I observed many things.
Okay.
Yes. Actually, you were too good as you are a teacher.
All right, glad to know.
Yes.
And I was trying to be a little furious with him.
Yes, yes, yes.
Okay, I tried putting not my expressions more,
Exactly.
but I tried putting my such kind of infuriated words
Exactly.
so that he could feel it. I'm glad that you're complimenting.
Thank you so
Okay.
much. The thing is that Barnabas was going good, but due to he's currently not used to speak or
Yeah.
yes,
Mhm.
as we are Pakistanis, as you know.
I understand, but first of all, we're complimenting that Barnabas
Yes, yes,
has
he
gone
was
quite
confident.
well.
He was confident.
He deserves a small clap, by the way. You did well then. Okay.
Then I wish when I will be there.
Okay.
Then
All right, you will have your day to come here as well. By the
Yes.
way, it's a sitting of our small 1-to-1 or 2-to-1 classroom setting. Okay, so sometimes we take the role plays like this. Okay.
Barnabas
Fine.
was
You will
too
say
good.
something. Yeah.
Yes, and then he was flexible.
He was flexible.
Yes, during
He
the-
was polite, by the way.
exactly.
Okay, that
That's
was
the
very
main
good.
thing.
That
That's the main thing.
kind of cooled me down. That okay,
Exactly.
someone is trying his level best to be with me. That was the
His
best
behavior
thing.
was quite good, and that was too kind.
Mm-hmm.
So I was happy when he was talking about his profession.
Yeah, he didn't lose his temper, by the way. Okay, when I was trying to, touch him, to the corners where he was not supposed to be touched, but he remained calm and cool and in his own profession.
And he was also telling you about his doctors, and he was covering.
What kind of problems which were there? Yeah, I agree with you. I'm glad that you are speaking such high words. Would you allow me to give my feedback to him now?
Sure, sure.
All right, Mr. Barnabas. First of all, you see there are 4 basic criteria on which we check. Okay, the first one is intelligibility. Okay, and then the next is fluency, and the third one is appropriateness of language, and the fourth one, and the most important one, is grammar and expression. Okay, when I talk about intelligibility, I found you over there quite much. When I talk about the fluency, I have my doubts about it. I would try giving you 3 out of 6 in that. Okay, and then it comes to appropriateness of language. It was appropriate, and besides that, the kind of bubbles you were giving it into it, kind of giving some terms and explaining them, that is even more better for the appropriate language. And about the grammar and expression, I do have my doubt about it, especially for the expression itself. Expression is the facial expression as well as the grammatical expressions you were putting into that. Okay, so we can talk about that. I'm happy with the kind of tone you throughout had. It was quite polite. I don't know whether it's being recorded in the camera or not, but to me it was quite polite, quite humbled, quite low tone, which tells that okay, gee, I have done something wrong. Whether you did nothing wrong, but because of the doctor itself, you took the pain and you said, okay, gee, something bad has happened from our side. I am apologetic without saying apology, and you tried showing with the tone and convincing power of yours. There was a positive thing about it. And most importantly, about you were well in the point, you were understanding me. Other than the one question I asked from you, and I said, it's been how long that you're serving here? You couldn't get that first, and I had to rephrase it. And then you said it's been 6 years that I'm serving. Well, that's okay, but you were not using any phrases I have given you.
Yes.
That's a major concern. I want you to listen to them. And I have a problem with the involunteer movements you have. You see, when you start speaking, even if you are speaking something negative, your body says positive, okay? Your body speaks it in a different way. You try nodding your head more than required. And please do understand that concept. Your body and your language shall be aligned with each other so that you give a maximum confident look, and of course, it will tell upon the performance you have overall. To cut a long story short, I'm glad that it happened with you today. And all of you who are listening, if you're a doctor, nurse, or from paramedics, any 12 of the areas OET encompasses. We are here in IET Islamabad helping you to achieve your desired score as well as your destinations. God bless Pakistan. Bye bye.